everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Messi Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Today we are going to be talking about burns. Growing up as a child, whenever I hear burn, the first thing that comes to my mind is fire, fire, fire. But is that the only cause of burn? What is burn? What are the causes of burns? What are the various classification of burns according to the depth? What is a nursing intervention? What are your roles as a nurse when it comes to burns? What are the pathophysiology of burns? By the end of this class, you will be able to understand and clearly explain all these things correctly. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Right, welcome back. Like I earlier said, today we're going to be talking about burns. What is burn? Burns are damage to skin integrity. It comes from various types of energy source. Burns are what? They are damage to your skin integrity. They are destructions to your skin integrity. And those damage can come from various types of energy source, which are the causes of what? Causes of burns. The first type of energy source we have here is heat, which is your thermal burn, which could be as a result of heat, which could be as a result of liquid steam, and fire. The common one we know, the popular one we know is the heat, burns from the fire. Then the second type of energy source of burns are the electric burn. I never knew electricity could cause burn, but yes, electrical current could cause burn, and it can be very disastrous, especially when the internal structures are being affected. The bones, the muscles of the heart, they are being affected. So electrical current can be very dangerous depending on the weight of the current. Then the other type is chemical burns. Chemical burns are as a result of toxic substances. It could be acidic substances, and it could also be alkaline substances. Then the other we have is cold burns. Cold burns is as a result of excessive exposure to cold, which generally results in what? Frostbite. I know we are not familiar with that. Then another is radiation. Radiation burns is as a result of your exposure, excessive exposure to sun, and also treatment in cancer using radiotherapy can expose one to what? To burns. Then the other we have here is friction. Friction such as abrasion to the skin. For example, when there's a road accident, there's an abrasion. And you know what something means? Abrasion, like a friction between the person's skin and the road or something. So these are the various types of what? Energy source causing burns. Then that takes us to the factors affecting the severity of burns. What are the various factors that tells you, okay, this burn is really severe, this burn is mild, this burn is moderate? The first here is the depth of the burns. Looking at the picture showing on your screen right now, the skin definitely has 4 layers. The first layer is the epidermis, which is the outermost layer. The second layer is the dermis layer, which is the second layer. Then we also have the hypodermis layer, which is beneath the dermis. So those are the 3 layers of the skin. We have the epidermis layer, we have the dermis layer, and we have the hypodermis layer. The hypodermis layer is where your subcutaneous tissue are located. So in terms of depth of burns, the depth to which that burns is the depth of the burns actually affects the severity of the burn. It could be just the epidermis, it could be just the dermis and the epidermis. So depending on the extent, depending on the depth of the burns, can affect what? The severity of burns. We have the percentage of total surface area burn. the percentage of total surface area burn can actually and sincerely affect the severity of burns. And this total surface area burns can be calculated using the Wallace rule of 9. That will be explained in another video. Then also age. When the elderly and children are being burnt, it is more severe compared to we, the younger ones, the teenagers. Then also the location. The location of the burns also determines the severity of the burns, especially those that get burns in the neck region, the upper respiratory tract is being affected, breathing is being impaired. Those people actually have severe burns because breathing is being impaired. So the location of burns is one of the factors affecting the severity of burns. They will also have inhalation injury. For example, there is a fire, definitely that individual is going to be inhaling a lot of carbon dioxide more than the oxygen, and that is going to increase the level of carbon monoxide in the body, and that's going to lead to the carbon combining with the hemoglobin, forming carboxyl hemoglobin, which is dangerous to the body. And when the carboxyl hemoglobin is greater than 15, there is a problem. So nursing intervention at that moment is like oxygen should be given. Then that takes us to the classification of burns. What are the classification of burns according to the depth of the burns? The first classification we have is the first degree burn. The first degree burn is also known as superficial burns. As the name implies, superficial is the top layer that is being affected, which is the epidermis. The first degree burn is also known as what? Superficial burn, and in the superficial burn is the epidermis that is being affected. And the first degree burn, it is red, the place is painful, there are nerves around that area, it is dry, and there is no blisters, because it is just the epidermis that is being affected. Then the second is the second degree burn. The second degree burn is also known as the partial thickness burn. In the second degree burn, it is red, it has blisters, and may be swollen and painful, extremely painful. In the second degree burn, what is being affected is your epidermis and some parts of your dermis. Then the other we have is the third degree burn. The third degree burn is also known as full thickness burn. In the third degree burn, where it has been affected is your epidermis, your dermis, and also some parts of the subcutaneous tissues can also be affected. In the third degree burn, it is usually white and blackened. There's what we call ischial. Ischial is formed in that area. It's a hard mass, a dead mass that is being formed. Then the other types of burn, according to the depth, is the fourth degree burn. This is the most, the worst of all, the baddest of all. And the first degree burns, the first layer, that's your epidermis, the dermis, the subcutaneous layer, that's the hypodermis, they are all affected. And the bones, the muscles can also be affected at this particular moment. And the fourth degree burn, this person, they don't normally feel pain. There is no pain because the nerves are dead. So the pains are not there. Remember, we have classification of burns. Classification of burns according to the depth. We have the first degree burn, we have the second degree burn, we have the third degree burn, and we have the fourth degree burn. That takes us to the pathophysiology of burns. In terms of the pathophysiology, what is really happening is that there's increased permeability of the capillaries. The capillaries are not very permeable in such a way that things can go in and go out. When something is permeable now, like things can easily enter inside and things can easily leave. So in this condition of burns, there is increased permeability, and this increased permeability occurs very fast. So when that increased permeability occurs, those plasma you see that contains your plasma proteins, that contains those things, they move to the interstitial tissues. Those plasma that were supposed to be in your intravascular space, that's where your blood vessels, those plasma that were supposed to be in your blood vessels, that were supposed to be in that intravascular space, they tend to move because of that increased permeability. They move from the intravascular space into the interstitial tissues. And when that happens, that movement, it carries sodium along. Sodium is moving, it's leaving the intravascular space. Albumin is also moving. We move. So both sodium and albumin move. They move from the intravascular compartment into where? The interstitial space. So when that happens, definitely when it's the sodium moves, it's going to result in this hyponatremia we have here. And there's going to be what? Hyperkalemia. Then when albumin moves, there's going to be what? Hypoalbuminemia. So the proteins is going to decrease, the sodium is going to what? It's going to decrease. Because as this plasma is moving from the intravascular compartment to the interstitial compartment, these two also what? They also move. So there's going to be decreased fluid in your blood vessels. And you know when there is decreased fluid in your blood vessel, there's going to be what? Increased heart rates. Let me go back again. You know everything is moving. They are going to the interstitial space. So in your intravascular, that's your blood vessels now, there will be reduced fluid. Because of that movement, there will be reduced fluid. And because of that reduced fluid, the heart will see, oh, what will I do? What will I do to bring everything back? It's just like compensatory mechanism. The heart rate increases. But what happened? There's nothing in the heart to pump. There's no fluid coming in. Even if the heart rate increases, the cardiac output decreases. Because there's nothing. All the fluid, they are moving to the interstitial tissues. The heart is trying to see what it can do by increasing the heart rate. But there's nothing inside the heart to give out. So there's what? There's decreased cardiac output. So when there's decreased cardiac output, there's going to be what? Decreased blood pressure. And finally, if not treated on time, if not treated quickly, it's going to land where? Hypovolemic shock. So this pathophysiology is what results in these signs and symptoms you are seeing here, which are what? The first is increased hematocrit. Do you know why there is increased hematocrit? You know, in the intravascular compartment, the plasma is leaving, so you have the blood cells. They will now be very, very thick. That's why the blood becomes thick. You check the hematocrit level, the hematocrit level will increase. Then also there will be hypoalbuminemia because there's movement of albumin. There will be hyponatremia because there's movement of sodium. There will be hyperkalemia because sodium, potassium tends to move in. There will be edema because the fluid are moving where? To the interstitial space. There will be decreased white blood cell. There will be decreased immunoglobulin because protein is needed in the formation of what? Your immunoglobulin. In terms of the phases of management when it comes to burns, remember the word here. The first is the emergent phase. In this emergent phase, it happens between 24 to 48 hours of burns to when the restoration of the permeability occurs. At this point, the patient is at risk for hypovolemic shock. Then the other is the acute phase. The acute phase begins from 48 to 72 hours to restoration. During this phase, that's when you talk about preventing infection. That's when you're talking about the permeability of the cells being replaced. Then the last is the rehabilitation. This has to do with healing, where you have to give psychotherapy, you have to give physiotherapy, and also cosmetic surgery if necessary. So that takes us to useful tips we have to put in our memory when it comes to the management of a patient with burns. Now let's talk about the nursing intervention for burns. When it comes to the nursing intervention for burn, the first thing you should take note of is airway clearance, breathing, and circulation. Your normal emergency management. Airway clearance, breathing, and circulation. So these are the first nursing intervention you should take into consideration when managing for the patient with burns. Followed by fluid replacement. You know, a lot of fluid is leaving the intravascular space into the interstitial space. So it's our duty as a nurse to what? Replace the fluid loss, to ensure that the intravascular fluid increases and there's what? Increased cardiac output. Then also, preferably, 2 intravenous sites. You have to monitor fluid intake and output. Your fluid intake and fluid output chart should be charted. I mean, your fluid intake and fluid output charts should be taken into consideration. Then also watch out for fluid volume overload. You know, you are giving this patient a lot of fluid, so you have to watch out for what? Fluid volume overload. Then pain management. Pain management is also very, very important, especially for the first and second degree burn. You have to talk about giving your prescribed analgesics and also providing diversional therapy for this patient. And also prevention of infection. You will agree with me that this patient at this moment, his first line of defense, which is the skin, is being damaged. So you have to what? Focus on preventing infection. Remember also, the proteins, they are leaving the intravascular space into the interstitial space, and the protein also has a role in the formation of your immunoglobulin. So when those things are reduced, what happens? This patient is predisposed to developing what? Infection. Wound dressing should be carried out in a sterile environment to reduce infection. Observe for signs of infection. One of the obvious signs of infection is actually increase in body temperature. So you have to observe for the signs of what? Infection. You have to check this patient's temperature to know, is the temperature increasing? Is my patient having temperature spike? So you know what to do at that particular moment. Debridement should be done. Those ischia that developed those dead tissues, debridement should be done to remove them so that blood flow can increase properly to that area. Caloric need should be increased. This patient should be served well, should be given well nutritious diet rich in calories to help him or her bounce back to normal and also gain enough energy to do its activity. Psychosocial therapy is also very important at this critical moment, because patients with burn tends to have this low self-esteem sometimes because their skin changes, their body changes, disability may come alongside. So psychosocial therapy helps to boost their self-esteem, help to make them know that it's not their fault, it happens, but life has to go on. Then also occupational therapy. Occupational therapy is very important, especially those that develop disability as a result of burns. For example, those that got their eyes burned, those that got their fingers burned, they will not be able to carry out their normal function as they used to carry out before. So occupational therapy that makes them blend effectively into the society should be given to those patients. In terms of nursing diagnosis for burns, I know a lot of people I'm waiting for the nursing diagnosis for burns. The first is usually ineffective breathing pattern in order of priority. Ineffective breathing pattern. It could be as a result of the burns to the neck, as a result of inhalation injury, evidenced by dyspnea. Then this patient can be having deficient fluid volume. Deficient fluid volume related to increased permeability, evidenced by what? Evidenced by signs and symptoms of dehydration such as oliguria. Then this patient will also be complaining of pain, severe pain. We have acute pain as also one of the diagnoses. We have risks for infection, and we also have impaired skin integrity as one of the diagnoses for what? For burns. Thank you very much for listening. Don't forget that burn is a damage to the skin integrity. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to drop your questions in the comment section, and don't forget to say hi in the comment section. And also, don't forget to watch and share with a friend. Thanks, and have a wonderful day ahead.